Sarah Carpenter, a 25 years old Caucasian female, is an individual with no history of disease or abnormal immune conditions. A week ago, she went camping and ate raw fish. 3 days after the consumption, she began to experience some abnormal symptoms, such as irritability in her stomach, vomiting, fever, which was way higher than 38 degrees, and headache. Therefore, she sought medical help right after. The doctor took a blood sample to run some tests, including ELISA. Her sample results showed that she was positive for Salmonella, and she had very extremely elevated level of interleukin-1 and interferon gamma. With her symptoms and the laboratory test result, the doctor suspects that she is suffering from Salmonella infection, as well as macrophage activation syndrome caused by the infection. And macrophage activation syndrome is a condition where macrophages are overactivated. These are my questions regarding my case. What is the significance of the elevated cytokines on the macrophages and T cells? Why is the elevated level of macrophage concerning when they can just help remove foreign pathogens? Would specifically targeting IL-1 and targeting interleukin-1 and interferon gamma signaling pathway to reduce its effect be the best way to treat her case? Why or why not? And this is my solution to question 1. The significance of the elevated cytokine is that it indicates that inflammatory responses in this patient is very high. It also indicates that the reciprocal activation between the T cells and the macrophages is exceeding the optimal level. The high level of IL-1 indicates that overactivation of macrophages. Overactivated macrophages present antigens to activate T cells, which makes them secrete interferon gamma. The high level of interferon gamma tells us that T cells are way too activated and consequently led to more activation of macrophage. It is likely that Salmonella activated the macrophages first because they're the harmful pathogens, and its prolonged presence pushed the reciprocal loop between them. This result implies that the balance between the D cells interaction is off in this patient. Question number 2. Macrophage plays an important role in inflammation by phagocytizing potential harmful molecules. However, in her case, macrophages may induce harmful effects as they're acting like a cellular bomb. They're secreting cytokines and pushing inflammatory responses beyond their needs, as well as activating excessive amount of T cells. Too much inflammatory response can lead to failure to resolve the inflammation and even to chronic inflammation. Also, activated macrophages release substance like ROS and protease, which can damage the surrounding tissues. This can lead to serious damage to her body tissues and their functions, and impact her health if macrophages continue being activated and inducing damage. Solution to question 3. The answer is not likely. It would help reducing the toxicity coming from the excessive level of cytokine, but it would not fix the fundamental source causing the macrophage activation syndrome, which is the Salmonella infection. If this is not treated first, macrophage will continue to be in the activated status and continue inducing their harmful effects. The abnormally elevated level of cytokines will not be resolved as well. Therefore, in her case, instead of trying to dampen the effect of interleukin-1 and interferon gamma, treating Salmonella will likely help her more directly. Instead of targeting the specific signaling pathways of the cytokines, the doctor may prescribe antibiotics first to combat the Salmonella first. And these are my resources.